Chinese President Xi Jinping has sent messages of sympathy to the president of Guinea, Sierra Leone, and Liberia over the Ebola deaths there. The president says China is willing to support the countries in containing the spread of the virus. 3 medical teams from China have arrived in Liberia as that country placed a 3rd province under quarantine. CCTV's Caterina Vitozzi has spent the past few days on the front lines of Liberia's struggle with Ebola.
This is Foya, the sole Ebola clinic operating at the heart of the Liberian outbreak. It's in northern Liberia, close to the borders with Sierra Leone and Guinea. Patients from all 3 countries come here for treatment.
From yesterday's report, we had 1 Q who was positive, and now the result shows negative. And we have 5 that was admitted, but they had negative results, so we discharged them. We had 3 deaths, the one that died previously in an ambulance, and we had 2 deaths, 1 confirmed and 1 suspected.
There's no cure for Ebola. Medical teams provide supporting treatments like making sure a patient is properly hydrated. It increases survival rates, which without treatment can be as low as 10%. But space here is running out. There's frantic building work underway to make more room for patients. More help, especially additional healthcare staff, are needed. Local health officials hope pledged international funding will soon materialize.
We are hoping that the process people will know that this is an emergency, and whatsoever donation that should be coming to the people, should be done more hurriedly, and so that we can respond to the people's need appropriately.
The Liberian government has accepted that it simply doesn't have the resources to control this Ebola epidemic alone. That's why the arrival of a team of disease control experts from China will go some way to support the local healthcare system. The team will train local healthcare workers not only how to best treat Ebola patients, but how to protect themselves too.
I think the epidemic is falling in a health system which is not strong enough. And you look at the identification of the cases, the whole surveillance is not very strong enough. The system in terms of the supplies, logistical component of it is also weak. Probably that also explains the high exposure to the health workers.
Along with medical expertise, the Chinese team will also bring Ebola-related medical equipment for healthcare staff, including protective suits, gloves and disinfectant. Caterina Vitozzi, CCTV, Monrovia.